way to get all of that amniotic fluid and stuff out. Some characteristics of a newborn. They might have an oddly shaped head because of sitting in the pelvis in the birth process. And vernix caseosa is the cheesy substance found on the baby when it's born. It's actually really, really good for their skin. And a lot of people, nurses and stuff, rub it into their skin when they're born. Lanugo is a fine, downy hair that a baby is born with, and it eventually falls out. Puffy eyes. There's a lot of times they put amniotic ointment on antibiotic ointment on their eyes when they come out to protect them from any bacteria or anything that they might come in contact with. And then meconium. This can happen after birth. Sometimes it happens in utero where a baby has its first poop in mom. And so they say that if it has like a split pea soup consistency, when the bag of waters breaks during labor, then that means the baby has had a bowel movement in mom. And so they want to make sure the first thing they do is suction that baby when it's born. They'll check for infection because it could cause a lot of infection if the baby breathes that in when it's born and takes that first breath. All right, so stool and urination patterns of a newborn. Okay, the meconium. It's the weirdest stuff. It's like a sticky, thick, tarry, greenish, darkish, brown stuff that lasts from birth for a few days. If the baby eats really well, it passes more quickly. Then normal poop is loose, green, brown, and kind of seedy. And then a breastfed baby, it's very liquid poop, sour odor, and then a formula-fed baby has normal, stinky, firm poop. Some complications. Miscarriage is the death of an embryo or fetus in the first 20 weeks of pregnancy. Most happen during the first 12, 13 weeks of pregnancy. And sometimes it's before a woman knows she's pregnant. Miscarriages end my doctor said it's more like 30% of pregnancies end in miscarriage. And it's usually because there's some type of genetic defect or chromosomal defect that wouldn't allow the baby to survive. Or it could be due to medications or illnesses, or sometimes there's just you don't know why. And then a stillbirth is when a fetus dies after the 20th week of pregnancy, and there could be lots of reasons. I have had miscarriages or super early, and then I lost my son Dominic at 30 weeks. He had some type of bleed. We don't know how that happened. But you still have to have labor and give birth to the baby, just like you would if it was still alive. You can get counseling and all that after. Make sure that you talk through how you're feeling, and family can have time with them. And the hospital made us like footprints of him and stuff to have time to grieve and closure and all of that. All right, a C-section or cesarean section is surgical removal of a baby. There could be many reasons for a C-section. Some of the ones that we talk about in class are if the baby is too large, okay, they can't get the baby through the pelvis. A lot of times is what it is. Mother has an active STD, like a herpes outbreak. The baby is in breech position, meaning butt first to the cervix. It's a danger to the baby because the umbilical cord could slip through before the baby, and that's its lifeline. That's its oxygen, and if it's compressed, the baby then is being suffocated. So it's really dangerous deliver a breech baby vaginally. And also, if the mother has had previous C-sections, they may have her do a C-section again, though a lot of women try to do a VBAC, which is vaginal birth after cesarean, depending on the reason for the the C-section. So they do an incision in the abdomen. Usually, if it's not an emergency, it's a horizontal incision around the bikini line. Okay, and then they do an incision into the uterus as well, and then they take the baby out, and then they'll stitch up the uterus and then the skin where those incisions were. All right, so these are significant milestones in fetal development. It was a lot longer, but I shortened it a bit just to show, or just to get through this. So the first month, by the 25th day, the heart starts to beat already. It's pretty awesome. You cannot see it yet, but they can, or you can't hear it yet, I should say. Month 2, all major organs and systems are formed but not developed. By month 3, the embryo is now called a fetus. The mouth has 20 buds that will become baby teeth, and you can hear the baby's heartbeat for the first time using a special instrument. And we actually rented one, and that way we could listen to our babies whenever we wanted to at home. It was very cool, and you can tell the difference because my heartbeat was much slower, and the baby's is like 120 to 170 beats per minute. And so you could always kind of see you can tell the difference between if I had it on the babies or if I was picking up my own. But it was a really cool opportunity to be able to kind of listen whenever I wanted. At month 4, the placenta is fully formed. The fetus moves, kicks, and swallows. Month 5, the fetus sleeps and wakes at regular intervals, and by the end of the 5th month, fetal movement can be felt by the mother. And actually, the more children that you have, for a lot of women, the earlier you can feel the baby. And it's really interesting. It's like, because when you first get pregnant, you don't know really what you're feeling. It's like weird. It's like little popcorn popping in you when you start to feel it. And then it starts to be more pronounced feelings. It's very cool. I think that's what I miss the most about being pregnant, is just being able to feel all that movement. Most of the time, when they're bigger, sometimes it can hurt a little bit. But month 6, the eyelids part and the eyes open. If the baby's born at 24 weeks or more, there is a chance for survival. But it would require months and months of intensive care. And the earlier they're born, the higher risk for complications and long-term issues, though there have been babies that have born at 24, 25 weeks that have been perfectly healthy. It just increases risks. So you don't want them to be born that early. Month 7, fetus opens and closes its eyes and sucks its thumb and responds to light and sound. If born now, it has a good chance for survival. My husband and I used to take a flashlight and put it on my belly, and then you could feel the baby scooch to the other side and then put it on there and the baby would scooch away. It was probably not nice. It was probably scaring it, but it was cool to feel that it was responding to that. And then month 8 is rapid brain growth continues. May notice the shape of an elbow or heel against your belly. At 37 to 40 weeks or 9 months, your baby is full term. So it is ready. Its lungs are ready to work outside of mom. It's ready to breathe oxygen. During the last month of pregnancy, the baby gains about 1/4 to 1/2 pound a week. The baby moves into position to be born, hopefully. So that would be head down towards the cervix. Usually let's see. By the end of the 9th month, the baby weighs around 6 to 9 pounds and is 19 to 20 inches long. So that is what the 9th month of pregnancy looks like, not much room in there. And this is also where the term fetal position comes in, those knees tucked in and the hands overhead tucked. Okay. There's also, I don't have it on here, but there's the postpartum time that's post pregnancy, because you have all these hormones that are present from the labor and the baby being born, and milk coming in to feed the baby, and there's emotions that can happen, like being really weepy and crying and you don't understand why. And there's some women that suffer from postpartum depression, which is, some of the symptoms would be trouble connecting with the baby, don't want to be around the baby, and sometimes extreme cases where they want to hurt the baby. And these are things that doctors are supposed to uh, give a questionnaire and check that mom is transitioning to parenthood okay, and maybe they might need some counseling or something. And there's nothing to be ashamed of. You can't control hormone changes, and sometimes it's just harder for some women. And it's okay to ask for help, and it's really important. Okay. And that is it.